Chapter 11, Depressive Disorders, Lecture, Introduction. Today we are discussing depressive disorders. By the end of this lecture, you will be able to define depressive disorders, identify 3 types, describe symptoms of major depressive disorder, identify treatments, and explain nursing interventions. Definition of depression. Depression is a painful and debilitating illness that affects emotional, physical, social, and cognitive functioning. It is part of a group called depressive disorders that distort how a person sees themselves, their life, and others around them. Depression is not simply sadness. It is a clinical disorder that significantly impairs daily functioning. Mood versus affect. Mood is a person's internal emotional state. Affect is the outward expression of that mood. Mood and affect should be congruent. For example, if a patient says they feel happy, we expect smiling, pleasant tone of voice, and relaxed posture. If a patient reports feeling fine, but appears tearful and withdrawn, that is incongruent affect. Mood and affect should also change appropriately depending on the situation. Prevalence depression affects individuals of all ages, ethnicities, and socioeconomic groups. Major depression is one of the most common mood disorders in the United States. Individuals have about a 16.6% lifetime risk of developing serious depression. Types of depressive disorders: major depressive disorder, persistent depressive disorder, postpartum, onset, depression, substance or medication-induced depressive disorder, premenstrual, dysphoric disorder, depressive disorder associated with a medical condition, major depressive disorder, symptoms. To be diagnosed with major depressive disorder, a person must experience 5 or more symptoms for at least 2 weeks, representing a change in functioning. Symptoms include sad mood, sleep, disturbances, fatigue, psychomotor agitation, feelings of guilt or worthlessness, weight loss or gain, loss of interest in pleasurable activities, decreased ability to concentrate, recurrent thoughts of death or suicide. Example, a patient may say, "Nothing brings me joy anymore. I don't even enjoy spending time with my family." Or grief versus depression. Grief can look similar to depression, but grief often comes in waves and self-esteem is usually preserved. Depression is more consistently associated with low self-esteem and persistent low mood. Prolonged grief disorder is categorized under trauma-related disorders, not depressive disorders. Etiology: depression is influenced by multiple factors. Biological factors include altered levels of serotonin and norepinephrine. Genetics play a role, as shown in twin studies. Women report depression approximately twice as often as men. Psychological factors such as helplessness, poor self-concept, loss, and grief also contribute. Medical conditions associated with depression: stroke, chronic kidney disease, dementia, cancer, adrenal disorders, hypothyroidism, Parkinson's disease, diabetes, brain tumors, chronic pain, myocardial infarction, multiple sclerosis. Always assess for underlying medical causes when evaluating depression. Treatment: depressive disorders are treatable. Most patients respond positively to antidepressant medications. Antidepressants target symptoms such as sadness, loss of pleasure, appetite changes, insomnia, restlessness, poor concentration, and negative thinking. These medications require several weeks to demonstrate full effect. Other treatments include psychotherapy, electroconvulsive therapy, ECT, and transcranial magnetic stimulation, TMS. Nursing interventions. Patience is essential. Depressed patients often move and think slowly, promote therapeutic communication, encourage patients to express feelings honestly, provide consistency in care and routine, encourage healthy nutrition and monitor intake, encourage appropriate activity, starting with small achievable goals. promote self-esteem by acknowledging small accomplishments, establish simple, realistic daily goals, such as getting dressed or attending one group activity. Conclusion: depressive disorders are common, serious, and treatable conditions. Nurses play a vital role in supporting recovery through patience, consistency, therapeutic communication, and encouragement.